One of my favorite naturopathic principles is doctor as teacher. The word doctor comes from the Latin root docere, which actually means to teach. I think it's really important for people to understand how their body works, how when things go wrong it can cause symptoms, and then what you can do to correct those imbalances so that the symptoms go away. Today I'm going to be teaching you 3 things that you can do to help manage any COVID reopening anxiety that you might be experiencing. So my first tip is really simple. It's just to say aloud how you're feeling. And I'm going to teach you why. There was a team of neuroscientists who did this really cool experiment where they had their subjects in an fMRI machine. They showed them images that were stressful, and then they watched to see what part of the brain was lighting up. And when they showed them these stressful images, it was the amygdala, which sits back here in the back part of our brain, that lit up. And the amygdala is associated with our fight or flight response, and it is also our fear and detection center. So this is like our animalistic, primal response for fear and danger. And that's what happens when we're stressed. Then they had the subjects look at the same stressful images, but then also say aloud how these images made them feel. And just by saying aloud how it made them feel, it completely changed the part of the brain that was lighting up. Instead, it was lighting up this part of the brain, which is called the prefrontal cortex. And that's the part of our brain that's associated with higher thinking, decision-making, and problem-solving. So just by vocalizing and saying aloud how you feel, you're transforming the part of your brain that's being used from this back part of your brain, your animalistic part of your brain, to your very human problem-solving part of your brain. My second tip is to focus on what you can control. There are a lot of things throughout this pandemic that are out of your control. You can't control what anyone else does around you, but you can control what you do. So let's take grocery shopping as an example. So you can't control what other people are doing, where they're moving, but you can control what you do. You can stay 2 meters away from people. You can wear a mask. You can be in control of how often you clean your hands with sanitizer or washing. And you can also control whether you go into somewhere based on how crowded it is. So there are a lot of things that are within your control. So stay focused on that and try not to worry about things that are completely out of your control, and that will help lessen your anxiety. My third tip kind of goes on the back end of that second tip, which is to also be sure to stay dynamic and flexible. So let's take grocery shopping again as our example. When you go out there, be prepared to have things happen that may be unexpected and plan for those things. So you might go to a grocery store. This happened to me the other day, and I stood in line for 10 minutes. The lineup was outside, and I was already in the line. I had my mask on. I had sanitized my cart. I was ready to go. And then I realized that the line continued inside the store. It was a store I had never been to it before. The line was moving quickly, which meant that there were a lot of people going in because the line was moving fast and it was a long line. And I decided that it was probably going to be too crowded in there. I didn't even want to risk it, and I left. And that was a decision I made on the fly. I didn't end up getting my groceries, and my fridge stayed empty for the next couple days. So be prepared to stay dynamic and flexible. Rigidity is what leads to anxiety. So the 3 tips were: say aloud how you feel, focus on what you can control and don't worry about the stuff that's out of your control, and be sure to stay dynamic and flexible when you do go out so that you can make appropriate changes as you need to on the fly. So I hope that helps reduce some of your reopening anxiety. Happy Naturopathic Medicine Week.